Hey, it's Dr. Ware checking in from University Animal Hospital in Tempe, Arizona. We've never really had a great tour of the facility to go out to the public, so I figured this would be a good start. As you come in, this is kind of our main reception area where we do check-ins, and so we have the history all printed out, and so we use electronic medical records. So everything's prepared, the full history is prepared, so that we're able to make things more efficient and easier for clients and for patients, because it's never fun to sit around or sit in a reception area or an exam room for too long, so we try to expedite that process. So this is our check-in area, and then we kind of head back into one of our 6 exam rooms. Alright, so we can come on through, and you can see all of our exam rooms are set up, for the most part, the same way. They're relatively spacious so that we can get everything done that we need to. We can do full physical exams, and sometimes there's multiple peoples. Everybody loves bringing the whole family around, which is cool. We have plenty of room. We have all the capacity to do our vaccines, do a full physical exam where we check out all the different systems of the body in the exam room itself, so that we're not moving back and forth a whole lot with the patient. All right, and if we do have to go to the back, everybody wonders what happens in the back of the office with our beloved pets. Well, not that much exciting stuff from your end, but from us it's a lot of excitement, because we can get a lot of stuff done. Having the facility this big, we can have so many diagnostics and treatments performed in hospital here. So come on back and we'll take a look. So as we kind of exit the exam room, we have a full lab facility in-house, so that if we need to perform diagnostics, on the microscope, drawing blood, we even have the capacity to do stem cell therapy here, and that can all be done in-house. So it's one of the benefits of having such a nice big facility, and having doctors that have all their little special niches that they really excel in. We also have a full pharmacy here, and you can see it's very tightly regulated. So we have a system called the Cubex that keeps a great inventory of all of our pharmaceuticals. That's injections and pills or liquids that we may have to give medications to your pet. So it's always stocked, and we're always constantly reordering, because on a daily basis we can see up to 500 pets in a day. Okay, here's where all the fun is. This is our main treatment room. So this is where we're going to be performing procedures, treatments, surgeries, whatever might walk in the door. You can see we have a full ICU where we have more of our intensive cases, our intensive medical cases, post-surgicals or surgical post-ops, to make sure that everyone's recovering nice and healthily post-operatively. Okay, we've got 2 wet tables so that we can do dentistries and other oral surgeries. So we're getting set up for dentistry coming in, a routine scaling to get the teeth nice and pearly white again. And then we always do full dental mouth x-rays to make sure that the roots of the teeth look healthy, just like you and I have done if we're going to the dentist once a year. We're cleaning up on the other dentistry machine, looks like, and getting prepared for another surgery to perform. Okay, our nurses are heading in right now to take some x-rays on a patient. But we have full digital x-ray, so digital x-ray and digital dental x-ray. It's much more clear. It's the old school where the old films, and sometimes you had to put them through a processor, or what we used to call a dip tank. That's getting way out there, where you'd have to process the x-rays manually. But now we have digital x-ray. The images are very crisp. It's much more, from a diagnostics standpoint, is to be more precise, to get better images. Okay, we've got multiple wards here to help kind of keep all of our patients separated, because although dogs like mingling and having fun at dog parks, in this scenario we do like to try to keep them isolated. We have an isolation ward, and this is used specifically for patients that have the potential to spread disease to others. Like, let's take an example of a classroom. If one person gets sick, then everybody gets sick. Well, the same capacity can happen in our scenarios, and so we try to prevent that sort of thing. So if we get a dog that comes in that has, say, canine parvovirus, that is something that's infectious and can spread to other patients, so we want to try to limit that as much as possible. We've got multiple other wards where we keep some of our patients. There's a very special patient today. It's Finnegan. It's my dog, and he's always happy to see us. So he's going to make a special cameo for today's video. He's a good boy. And if we're going to head down the hall a little bit further, we're going to head to our specialty procedures room, and that's where we're going to perform ultrasounds. Dr. Bastek is the queen of ultrasounds, and she does multiple throughout the week. Thanks so much for taking a tour of the facility. You can see with a practice this big, we have 10 doctors on staff here and actually looking to fill more spaces. We have a lot going on. We can do a lot of treatments, a lot of procedures, a lot of surgeries, a lot more than your kind of general, your common general practice can't perform. So it's a pleasure to have that capacity, and we would love to see you.